I'm Dr. Renu Chakravarti. I'm working as obstetrician and gynecologist for the past 25 years in Chandigarh and Panchkula, and have seen over the years lots of changes in women's care during pregnancy, during delivery and after delivery. This changing scenario has been mainly due to urbanization of the more and more women going into the career options, getting married at a later age and planning pregnancy at a delayed age. Pregnancy and childbirth, they have always been a very important landmark in any woman's life journey. But these things, they were always considered as a natural way. In pregnancy, delivery, a woman will get married at say 20s, then naturally she will get pregnant. She will not plan her pregnancies. Pregnancies have always been unplanned, and that's why they were getting pregnant at a younger age, and pregnancy related complications, they were less during those years as they were following the biological pattern. Scientifically, it has been shown statistically that the women they land up in minimal complications in pregnancy if they plan pregnancy, say between 24 to 27 years of age. That's why in the previous years, pregnancy related complications, childbirth problems, they used to be least. But these days, when the women are planning pregnancy at a later age due to their career constraints, they plan pregnancy, say in the 30s, when they are biologically, it is not a very safe age for getting pregnant. That's why some pregnancy related problems, complications are more in this time, and that's why they've realized this problem. They want to prevent and treat these complications treated at the earliest by consulting a specialist. In the previous years, due to lack of technology, non-availability of ultrasounds and not good tests available, Doppler studies were not available, good newborn services were not available, so abortions, premature births, intrauterine deaths and death of the newborns, the incidence of these things were more, and they were preventable. And they were unpreventable. They were unavoidable, these problems. However, over the years, with increasing technology advances, especially with the advent of ultrasonography, Doppler studies, fetal echocardiography, and the excellent neonatal ICUs, so many complications, especially detection of abnormalities in the fetus, care of the premature baby, and premature deliveries having lesser risks due to good neonatal services. These advances have really made we call it perinatal outcome, that is the chances of survival of the newborn after delivery, they have really become very good. Realizing all these things, there has been more and more importance of getting good antenatal care, that is care during pregnancy, rather care before planning the pregnancy. There has been utmost importance of pre-conceptional counseling, that is the counseling of the couple before planning a pregnancy. It has become very important. There is definite importance of pre-conceptional counseling when a couple wants to plan a pregnancy and visits the obstetrician before it. The obstetrician examines the woman, does her ultrasound, so that the woman knows that she doesn't have any tumors in the uterus or any other abnormalities in the uterus, and the doctor does some investigations to know that women is not having any thyroid problem, her blood pressure is normal, her sugars are normal, or if she is not harboring any other infection. If there is any problem, especially thyroid problems, blood pressure, high blood pressure, diabetes, the treatment can be started before planning the pregnancy so that pregnancy related complications can be avoided due to these diseases. If everything comes to be normal, a tablet of folic acid is started 3 months before planning the pregnancy. It has been proved scientifically that if a woman takes folic acid before planning a pregnancy, there are certain chances, the chances of certain abnormalities in the fetus can be minimized. This fact has been really proved scientifically. So now once a woman gets pregnant, there is definite importance of routine antenatal care in each month of pregnancy. Especially in the first half of pregnancy, there is definite importance of going to the doctor, getting her ultrasound done to know whether her pregnancy is in the uterus, if she is not carrying any twins, or if she is not having any pregnancy outside the uterus. This is the importance of first visit. Next, in the second visit, there is always, we want to know whether baby is growing well or not. This, so that the women is not landing up in any threatened abortions or any bleeding, so that if there is any problem, we can always treat her accordingly. Then comes the importance of antenatal care in the middle half of pregnancy. Middle half means when the pregnancy is about 4.5 months, that is 18 to 19 weeks pregnancy. Certain investigations are done to rule out some genetic problems in the baby, in the fetus, and to know any abnormalities in the fetus. These days, with especially with the advent of good ultrasonologists and ultrasound machines, the experts can detect all major and minor abnormalities in the fetus. Fetal echocardiography can detect abnormalities in the fetus heart, and if any abnormality is detected during this time, which is going to be harmful for the baby in the long run, the pregnancy can be immediately terminated. The benefit of this particular investigation, that is ultrasonography, fetal echocardiography, is that any abnormal baby is not led to born, and everyone knows that abnormal baby is a burden on the parents, on the society, and on itself. There is also importance of doing some blood investigations in pregnancy of the mother and the father to avoid a problem of thalassemia major in the newborn. Next, then in the later half of pregnancy, the doctor, specialist obstetrician always checks how is the baby growing in the mother's womb, how much is it really keeping pace with its time, if it is weak or more healthy, so that if there is any problem, it can be treated. And especially if there is high blood pressure and baby is not growing well in the mother's womb and baby is not getting good supply, this baby can be taken out, and by good neonatal services, ICUs, this baby can be easily survived. These things, they have been made possible only with the advent of expert obstetrician cares, expert ultrasonological services, and expert neonatological services. But these can be done only if the pregnant woman visits the doctor regularly and the doctor also examines her very carefully. Then comes the importance of good care, that is during delivery, and expert care during delivery, so that difficult deliveries can be avoided, timely cesarean can be done to prevent any complications in the mother and the baby. Next, after the childbirth, there comes a role of care after postpartum care so that the women can be concerned about family planning, her own health, her contraception, and after she has completed her family, the doctor advises her for family planning, contraception, and cancer awareness. Thank you.